I'm back. And Amy, do you want to introduce yourself? Or
I'm Amy Marzolf, and I'm a nurse practitioner at the Hospital of the University of Pennsylvania. I work with Dr. Owens, and I know many of you in the audience today.
so we're just going to spend the next few minutes sort of talking about living with your disease, sort of taking control of your disease. And again, I'm going to spend my few slides sort of talking about the same theme of communicating with your cardiology team, your other physicians, what we're interested in knowing from you, how you can take charge of your health and really keep us on the ball as well. So just acknowledge starting out, it can be overwhelming. So we've sort of talked about these two terms already today, but I just want to be clear. And so for you and to tell your other doctors and your sort of non-cardiology care teams as well, you know you have cardiomyopathy, someone in your family has cardiomyopathy, it can be overwhelming. There are different risks associated with your disease. Your other practitioners may not be as familiar with it, which is why you may feel sort of burdened by the need to know more about your own health conditions and maybe other people walking around without cardiomyopathy. But having all the right information can make a huge difference for your care. So here we're just going to be talking about cardiomyopathy as a structural heart disease, a problem with the heart muscle, and then heart failure, sort of the symptoms that I talked about earlier, the symptoms of losing your breath, swelling, sort of the advanced stages. So one of the first things to know is sort of just where you are at what we say your baseline. So we'll ask you that question a lot. When you're at your baseline, when you're feeling normal, what can you do? So on the left here, you'll see a little graphic that shows you the New York Heart Association heart failure classifications. We've spent a lot of today talking about 2019, so many things are advanced. The New York Heart Association came up with this classification in the early 1900s, and you'd be like, why don't they have anything better than that yet? Right, it makes no sense. It turns out we've studied this over and over and over again, and we still use this classification in our big studies we've mentioned throughout the day today, that we found that asking patients these questions, figuring out where they are on this spectrum is really helpful for us to think about where they are now and where they're going to go in the future. So again, helping you understand our framework of when we ask you those questions about what can you do you do your shopping, do you mow your own lawn, can you do the housework? These are the kind of questions we're trying to answer in our own head. Do you have symptoms at all? Maybe some of you don't, and that's awesome. Maybe you have symptoms that are mild. Maybe you can go up 2 flights of stairs without a problem. Maybe you can, do half the lawn and you're doing okay, but you got to take a break while you're doing the rest. Or do you have significant limitation? Did you used to be able to walk across the street, Market Street with no problem, but now you've noticed like, wow, after a couple blocks, I am really short of breath. That's a change. And then sort of the fourth is, are you severely limited? Do you have symptoms while you're even sitting at rest without exertion? So having a clear understanding of where you are at your best, what happens to you when you start feeling worse, what sort of benchmark activities can you use, something that you do really frequently, but you're able to notice changes in. So for me, I take the trolley every day, and I know that I can go up those 4 flights of stairs, no problem. Some days, when I haven't been exercising like Dr. Day tells me to, I get a little short of breath at the top of the 4th stair. I'm aware of that, and I sort of keep track of that. What you need to know, and what's really helpful for us when you come to see us and any other doctor is, of course, what disease you have. These are really long, complicated medical names. We totally understand that. So, make a note on your phone, keep it somewhere, have it spelled out. It's very helpful for people that are, they may be caring for you sort of outside the cardiology setting. Maybe they're not as familiar with arrhythmogenic right ventricular cardiomyopathy, but it's very helpful for them to sort of see it written out, know exactly what it's called. What your medicines are, you all know that, what the warning signs are. As we've just talked about, how much activity you're recommended to have or allowed to have. We'll say allowed here, but what's recommended for you in your specific case. Any lifestyle changes you've made recently in your follow-up plan. And what that means here, we use the term follow-up to mean sort of your ongoing care with your doctor. So are you usually seeing your cardiologist every 3 months, every 6 months? What's happening in between? Are you calling them to check in? Or are you in the phase of your medicines actively being changed? Or have you been stable on these medicines for quite some time? Those are all important to know. And of course, who your support system is. And just a little bit more about medicines, knowing what you take and when, we'll sort of ask you that. We have a bad habit of sort of assuming that everybody takes their medicines first thing in the morning when they wake up. We know a lot of you don't do that, and sometimes you take them before bed, in the middle of the day, when, sometimes when you're going out, you won't take them. that's fine. Just tell us that. It's very helpful for us to understand sort of your medical condition, your medicines, and you as a person. All of that is very helpful. So if you have an issue remembering your medicines, we recommend a pill box, trying an alarm, having some with you. Don't leave home without them. And remember, especially for our conditions that we're taking care of, we consider these medicines for now as lifelong. We're going to be changing them if things change. We will titrate the medicines or change the medicine doses for you. But again, as I mentioned before, these are ones we really want to keep charge of. So if anyone else is changing them, we want you to call us before you let that happen, and sort of remember that we'll do our best to keep the strongest that your heart can be. But remember that usually you're not going to come off these medicines unless, there's a real reason for us to do so. We talked a little bit already about food and fluid, so I'll just sort of put this up here and let you all take a look at it. Some tips we recommend is, bring your own food. We often talk about salt and fluid, you'll hear, especially for the DCM folks. So there's salt everywhere. You can't avoid it, but we'll try to ask you to, don't add extra, or keep in mind what's happening, what you're eating when you go out. So maybe ask for things on the side, or ask for baked or grilled things. And then you're often given instructions by your doctor team about the fluid intake. So 64 ounces, 2 liters, 1 liter, at certain points this may change depending on what your fluid status is. So just be mindful of that and have a way to keep track. I can't formally endorse any app standing up here, but there are certainly apps for all of these things as well, tracking your food, tracking your fluid intake. So if you're someone that likes to be on the phone, there are great apps out there for it. And of course, just find what fits you. We'll often ask about your weights as well. So if you have a home scale, that's very helpful for us. We'll ask you to weigh yourself frequently and keep a track of it. The water and fluid we've talked about. A blood pressure cuff we'll often ask you to have, and you can feel free to ask us which ones we recommend. That often they're covered by your insurance. And of course, as I mentioned, there are apps for everything. Now I'll turn it over to Amy.
So one thing you want to make sure that you're doing in terms of feeling overwhelmed and having this diagnosis is that you're maintaining your social life and thinking about what's important for you. Why are you doing this? Why are you trying to stay well and healthy and making time for those things, whether it be family, whether it be friends, whether it be grandchildren, all of those things, making sure that you can get to them and get to them easily because you've built in a system that works for you. So, and you want to be able to reach out to your team and tell them if you're having trouble getting there and getting to do the things you want to do. I once had a patient who was quite young. He was on milrinone, and he said, what I really want to do is I want to get to this wedding. I said, that should be fine. We have no problem with that. And then at the end of the visit, he said, oh, by the way, the wedding is in Seattle. Did I forget to tell you that? So he's on IV milrinone, and we need to set that all up. So we make sure he gets enough milrinone. And what he said he wanted to do in going to the wedding was that he wanted to dance. And I thought about it, and I sat him down, extended the visit a little bit, and said, well, we got to get you able to dance there. So it's going to involve a couple of things that you probably won't like to hear me say. Like, you're going to have to get through an airport in Philadelphia, and then again in Seattle. So what would you think if you called ahead and made sure they had a wheelchair waiting for you? And he looked at me and said, are you kidding me? I said, well, we're trying to compromise. You want to dance at the wedding, right? So he did it. And the good news was he made it. He got to the wedding, and he danced, and he got home, and he looked great when I made him run into the visit like 2 days later to make sure he did fine. So I think, again, think about what's important to you living with this disease and how we can get you there, and work with your care team. So even having done this since I was a baby nurse, always working in the field of cardiomyopathy, it still amazes me when I see a new patient in the room and I can't tell who's the patient and who's the family member. Cardiomyopathy doesn't look like an illness. Many patients who are in this room, everybody looks well, and you don't wear it on your sleeve. You also won't get the same reaction as if you sat in a room and said, hey guys, I have cancer. Everybody would come running your way and say, what can I do to help? But I think because you look well, it's very hard for people to understand that you're dealing with a chronic illness. So you are a lot of the decider of what people get to know and don't know and what you're comfortable with. So finding finding that support and deciding who it is crucial. And, some people will need mental health support to do that. That's who they feel most comfortable talking to. Organizations like this that link people together, finding other people who are in your situation, that's where people might feel comfortable. There might be some awkward situations where you need to educate the group of people on what this means and what's going on. There might also be some situations where people don't really get it. A young person who comes out of their car and is in the handicapped parking spot, for example, and the police officer comes up to them and says, did you borrow that from your grandmother? And meanwhile, now they carry a letter around to say that they have cardiomyopathy because they want to be left alone. But again, it's your decision on what you want to share with what people. This actually is a picture of a doctor who recently went through transplant at the University of Pennsylvania, and she has a blog called A Change of Heart, I believe it's called. So again, you can find these intimate stories and really be able to relate to people if you're looking. So being a good caregiver. So a lot of people here are here because their loved ones have a diagnosis. So the same slide that Dr. Reza showed, which says, what do you need to know to be a good patient? I think you need to know to be a good caregiver. Your first, knowing the disease, the medicines, the warning signs, the activities, what things you should be aware of as a caregiver will help you. Now, being a caregiver, and if you're like me as a mom, you want to take over and be in control. But I think the key there is to try to empower the person you love to deal with their disease. You are their backup eyes and ears, and this can't be more true. When somebody, many of my patients, at least what I've seen is, as opposed to coming in with an acute change, it's very slight over time. So they don't realize that they're no longer walking as far at the mall or avoiding the grocery store. So when you're with people and you see something different, you're their eyes and ears, you're their backup plan. You're the one to say, hey, I think we should mention this to the doctor. If somebody actually physically needs help, I think that that's a good place for you to come in and help. You can also just stop and ask them, hey, what do you need from me? What would help you? And take time for yourself as a caregiver. Caregivers need breaks too, so you need to make sure that you build that into your time so that you can get away and you can take rest. You need to take care of your own healthcare needs. That means going to your own doctor's appointment, going for your own screening visits, making sure your own blood pressure is managed, and these things. Frustration. Because you're the person closest often to the patient, you might feel that frustration and sometimes anger and know that that's directed to the disease, even when it feels like it's directed to you. Now, what about a patient with cardiomyopathy and working? Everything here is a balance, so health and disease, it's all balancing this out. So the things that we've talked about, like monitoring your sodium, eating a good diet, making time for exercise, and doing these things, they become more important. So you want to make sure that you're building that time in and making that balance. And then also, it seems like when you're first diagnosed or if you're in a more hot phase of your disease, it's right at the forefront. But when you're doing okay, it goes to the background, and that's when you really want to make sure that you're making time for your disease, that you're making your follow-up appointments, that you're coming in. And if you need, you could get FMLA paperwork even filled out to make sure that you can make it to those appointments. Job specifics, what you can and can't do, that's going to be very individualized with your provider based on whatever your work environment is. But sometimes it can be as easy as, I can't get to the restroom if I take my diuretic, and your provider can write a letter asking for your desk to be accommodated at a closer place. So, it should be a conversation you should be comfortable having. This is a lifelong diagnosis, so that's also key, that you're not going to be dismissed from care. I think I grew up in an understanding that you go to the doctor when you're sick, you take your medicine, you're better, you're fine, you're done. And then you have a cardiomyopathy, that's just not going to be the case. You're going to need to be seen and followed longitudinally to make sure that things are going in the right direction and to make sure that you're getting the appropriate monitoring. The genetic component and approaching families. I think when you get diagnosed with a cardiomyopathy, things that we talked about primarily today are that your family can be at risk. And this is a difficult conversation to have because maybe you're the one in the family who's the person who's sick. So going to people who are well and kind of don't want to know that there's this possibility and approaching it can be quite difficult. There is this mentality that that's you, that you're the sick person, and it's not me, because I don't have any symptoms. And clearly you're having symptoms, so I'm fine. And trying to tell people that your provider has told you otherwise can be difficult, but a conversation that needs to be had. Excuse me. There can also be a lot of fear surrounding that. Pardon me. Fear that they could be somebody who could have disease, and just fear of knowing that and learning that. So that initial screening visit for people to come in, I see those screening visits in my practice, and I feel the fear that's palpable. People are waiting to be told that they're fine, not them. So it really exists. Insurance issues. I'm coughing more because this is my least favorite topic and I would like to avoid it entirely. But I think that this is important. Health insurance, having a cardiomyopathy can count as a pre-existing condition. Maintaining your insurance, making sure you keep coverage when possible is ideal. Life insurance is an issue you should start thinking about, ideally before you get screened. There are laws to protect family history and genetic testing from prohibiting you from getting health insurance, but those laws are not effective for life insurance. So getting things in place makes sense to do beforehand when possible. Now, be honest with yourself and be honest with your care team. If something's not working, tell us. We want to know. We're not going to be upset with you. Well, maybe a little, but we'll get through it together. If you're coming in and you're volume overloaded and you're not taking your afternoon diuretic, say it. Just tell us, because maybe we can come up with a different plan. If every weekend you like to go out with your family and you eat extra salt because it's at a restaurant, maybe we can up your diuretic on the weekend. If a 2 ice a day med isn't working, is there a replacement? We don't know what's going on with you, but we desperately want to, because we actually don't want you in the hospital and want you to do well. If you're feeling different, tell us early, because I'd rather tweak your medicine here than wait till you're in the hospital. So ultimately, my thought is that you are the navigators and we're here to be part of your care team. We care about you and want to work alongside with you, and we do think about following you longitudinally. So any way that we can help facilitate that, we will. Oh, and there's no time for it, so sorry. That's it.